Good morning, myself Doug Sadaria. I'm a student of third year B physiotherapy. And my today's topic in the orthopedics is the complication of the fracture, and one of the complication is the DVT. So, what is the fracture? First of all, a fracture is the break in the continuity of a bone caused by trauma, stress, or pathological conditions. The common cause of the fracture are the road traffic accidents, fall, sports injury, osteoporosis, pathological diseases. The complication of the fractures. The early complications are the hemorrhage, shock, neurovascular injury, compartment syndrome, DVT, which is deep vein thrombosis, fat embolism syndrome. The late complications are the delayed union, non-union, malunion, joint stiffness, muscle wasting, and osteomyelitis. The deep vein thrombosis. The deep vein thrombosis is the formation of the blood clot thrombus within the deep vein, which is usually found in the lower limbs. The common sites are the calf veins, popliteal vein, femoral vein, and iliac vein. Why does DVT occur after the fracture? The main reason of the DVT after the fracture is known as the Virchow trade. The Virchow trade means the venous stasis. It is caused due to the prolonged bed rest, immobilization of the lower limb, the endothelial injuries such as the trauma through the blood vessels during the fractures. The hypercoagulability means the increased clotting tendency after the injury or the surgery. The risk factors of the DVT, the patient factors such as the age above the 60 years, obesity, smoking, previous DVT, cancer, and pregnancy. The fracture-related factors such as the hip fracture, pelvic fracture, lower limb fractures, orthopedic surgeries, long-term immobilization. The signs and the symptoms of the DVT. The clinical features such as the calf pain, tenderness, swelling of the limb, warm skin, redness, discoloration, dilated superficial veins, increased calf circumference. The warning signs, just like the sudden shortness of breath, may indicate pulmonary embolism. Diagnosis. The special tests like the Homan sign. The pain in the calf during the passive ankle dorsiflexion, not highly reliable. The Wales Clinical Prediction Score, commonly used in the clinical screening tool. The diagnostics such as the CT or MRI scan, Doppler ultrasound, D-dimer test. The complication of the DVT. If the DVT spread through the lower limb to the lungs, it can lead to the pulmonary embolism, which is the most serious complication. The most post-traumatic syndrome such as the chronic pain, swelling, venous ulcers, other complications like the recurrent DVT, chronic venous insufficiency, reduced mobility. The contraindication. Any kind of physiotherapy, exercise, or treatment is totally contraindicated in this case of the DVT. Thank you.